Okay, yesterday I started talking about spina bifida, how it worked, what it was, why it happens. I think more to the point, what the common causes were and what really it is. I want to try and finish that today. I did find the most common symptoms in this. I'm sure that there are a lot more, and you know, but as we have to keep this purely down to as many facts as humanly possible and not go off in too many tangents or find too much research, because if I start spouting all that, I will have this taken down and nobody wants that. Well, I don't want that, to be fair, because I like it. So so what I did is I sectioned the symptoms into their conditions, to a point anyway. Not completely, just a little bit. So you get an idea as to the kind of common things to look for or to see, or that you'd notice, or that you'd be going through, or that they would be going through. And then I listed others, obviously. So I'm going to start talking. So yeah, I'll start doing all that. Head's a bit kind of weird today. So if I start sort of rambling, yeah, ignore me. So with the spinal occulta, because it's the hardest to notice, it's not something that is noticed at birth, it's not seen at birth, and it can go unnoticed. It saying that, it can go unnoticed, right? It can be seen in newborn skins. So you'll find things like tufts of hair on their skin, things like small dimples or birthmarks. So if they've got things like that and there's tufts of hair in it, that could be a sign of things like of an underlying issue. But you will only see spina bifida if the baby has a spinal MRI or a spinal ultrasound. It's only the spinal ones that will give you that diagnosis. Now I get to the ones that I can't pronounce, because I can't pronounce them. So the meningocele, the meningocele. I don't know why these things have such weird names, but they do. Causes problems with blatantly the bowels in your bladder. So you are looking at things like incontinence, realistically, as well as that's just. I mean, the weirdest thing, that one is the rarest form of it, and being the rarest form, it gives you minor things. Well, they're not minor, but I mean, they're minor enough for them to not be sitting there going, oh yeah, it's really severe. And then you get the weird one I can't pronounce at all, which is spelled MELOMENINGOCLE. Oh, I don't see the point of. So that is one that is spotted at birth. No ifs, buts, and maybe the spinal cord is open from like the lower through to the middle of the back, on like through several vertebrae, like spine bits. So it's both, and that one affects both the membranes and the spinal cord nerves. So the spinal cords or the spinal nerve, and head is just not with it today. Spinal cords or the spinal nerves, I can't even wrong with it. Because it will protrude at birth and form like a sac. So they'll see it the second the child's born. So you have tissues and nerves that are exposed. Yeah, it's not nice. It can't be pleasant. And that's like general overview of symptoms, and now we get to the complicated things and the complications of what happens throughout their child's life. So depending on obviously which form they've got, you get things like the size and the location of the defects, whether the skin covers the affected area, which spinal nerve comes out of the affected area of the spinal cord. Those are just major complications, but we get other symptoms which come from all of this. So you'll get walking and mobility issues. Now, when my son was at nursery, he used to spend a lot of time with this one little lad who had spina bifida. Because that little lad spent a lot of time on his own, sort of away from the groups. My son spent a lot of time with him, purely because it was quieter where he was. And they used to do things together, nice and slowly, nice and easy. He had a wheelchair, he could things, but he liked to be out of his wheelchair sometimes, and he could use his hands to pull himself along. It's kind of cool. So they can get to a point where even from a very young age, they're sort of 2-year-olds, they won't be able to walk. A good friend of mine, his son, also has spina bifida. Now, his son is now the same age as one of my sisters, funnily enough. Roughly about the same age as one of my sisters. He's in his like early sort of mid-20s. And so he's in his mid-20s now. He's going through university. He has got a wheelchair. He also uses crutches to help him as well. So he can move about on his feet very, very slowly. But he has the use of a wheelchair most of the time. So, although he uses a wheelchair a lot of the time, he can get out of his wheelchair and use crutches to move around on his feet. Their home is very much set up so that when he comes to visit, because he lives in a care home now, in a residential home, he comes and his dad goes and picks him up pretty much every weekend, takes him home, and they spend most weekends together. They're incredible. They are so close. And the house is set up and there are bars throughout most of the house. It's completely set up for him and he can pull himself around the entire house. It's kind of cool, when you actually watch them together. So there are a lot of mobility issues. Because there are nerves that controls the legs. Obviously when you talk about the spine, now anybody who has any kind of back pain or back issues will understand that when your back is in severe pain, that pain will shoot down your legs. And that is because it's connected. There are a lot of nerves that are connected to your leg tissues and your leg muscles, and if your back, your spinal cord, your spinal nerves are not connected properly, it will have a massive effect on the nerves in your legs, because they're all correct. They are all connected. So there will be things like either muscle weakness or even complete paralysis from the waist down. So it will actually be, they will either have the ability to walk or they won't, but it will depend on what kind of spina bifida they have and the care they get at home and in the hospitals, because there is, now my friend was telling me several years ago, a while ago, that there is an actual operation that is available for people with spina bifida that can help them walk, to give them back some use in their legs, for people with certain types of spina bifida. You know, so that is an option as well. You know, so I mean, there are things that can help people with spina bifida, who have movement issues, muscle issues in their legs, movement disorders. It takes a lot of work, it takes a lot of practice, and it takes a lot of care. So if that is an option for you, and or for people that you know, and the care is there and the care is given, and I mean, he said it's an amazing opportunity, and it was an amazing opportunity for his son. But you know, he can walk around a little bit now. He never got that operation for reasons, you know. But there, it was unfortunate, but there was nothing they can do. In the end, they gave him the option. Something happened, then he couldn't have it. But he is up on his feet sometimes, and he loves it. You know, he's having a good life. He's went through uni. He's a great lad. So I mean, there are a lot of things available for people with spina bifida. And then we get to things like the orthopedics. And that very nice long word that I can't pronounce. Right. Can have not just the leg issues, they'll have things like curved spines, because they'd have, or an abnormal growth or dislocations on their hips. Bone and joint deformations, and muscle contractions, which makes sense considering that very nice long word means that with the openings in the spine, they form sacs. You know, the spine tissue, the tissue comes through the spine and forms nice little sacs on their back. So it's not surprising then that they can end up with abnormal growths or even curved spines, because it's pushing on the spinal cord and the spine, on the actual bone itself, every time it pushes through. It's not actually surprising then that it can cause things like a curved spine, or even things like abnormal growths. I mean, when you're talking about bone and joint deformations, your body is built a certain way. If something is out of whack, your whole body kind of will be out of whack. So with the disjointment of your spine, your hips will then move in a different way. So it's not surprising that your hips and your joints will then slightly deform, or could slightly deform. You know, because your spine isn't aligned. You know, and because it's happening from birth, you know, you're born with these sacs on your back because the tissue has pushed its way through. You're born with all of this. So as you grow, the deformations will appear. It can't be very nice, to be fair. It must be horrible. It must get really uncomfortable for these people. I mean, you can imagine that, I mean, as we all grow and whatever else, nobody notices as our muscles grow and our bones grow and everything else. But it must be hard for parents to watch their children grow like this and be born like this. It must be devastating. I mean, because on top of all of this, you then get things like bowel and bladder issues. and an accumulation of fluid in the brain can happen. That if that happens, that can be really dangerous, you know, because then you get things like a shunt. Now, we see if you get fluid in your brain, what they do is I had to look this one up because I came across that one that said shunt malfunction, and I'm like, what on earth? So I had to look it up. What it is if you have an accumulation of fluid in the brain, right? Someone with spina bifida gets fluid in their brain. What they do is they put a shunt inside the brain, somewhere inside the brain, to stop the fluid from being able to accumulate and to keep you healthy. But if that shunt then malfunctions, or even completely stops working, what can happen? It can stop for many reasons. It can malfunction for many reasons, but it could be because there's an infection in the shunt, or an infection inside the brain somewhere. It could be because there's too much of a fluid accumulation. For many reasons, these shunts can malfunction for. If they do, they will and they can suffer with things like, there are signs and symptoms that they will suffer with, and they start with things like headaches, vomiting, sleeplessness. They feel very sleepy. They get very irritable, and of course things like swelling and redness from the shunt itself. So it will start to swell up, and that's got to be, that's like a number one sign. But if you've got a shunt in your brain and you start getting headaches and start feeling sick, that I would immediately go see a doctor, straight to the hospital. I wouldn't even stop. I wouldn't straight to the hospital. I would go and get it checked out, because if it starts to get to things like swelling and redness in the shunt, you're in real trouble, because then you get confusion. You could end up with like a fixed, the symptoms just sort of get worse from there, because you get things like a fixed downward gaze. You have trouble feeding yourself, and then you'll start getting seizures. So yeah, if you know somebody, or you are somebody with a shunt in your brain, and you even start feeling like you start getting like loads and loads of headaches, you start throwing up, straight to hospital. I wouldn't even, don't stop, don't pass go, don't collect 200, no, just go straight to hospital. Get yourself checked out, just go. Don't wait for any other signs and symptoms, just go. Because what it can lead to in the end are things like meningitis, which is like super serious and can actually be fatal, on top of like loads of other complications that, the list gets really dangerous and it gets really serious. So there are a lot of things that can happen to somebody with spina bifida, especially if they have like the most severe one, that I can't pronounce to save my life. But diagnoses are really, actually, to get a diagnosis of spina bifida, it's actually really, really super simple, because generally as a rule it's spotted at birth. The only one that is difficult initially to diagnose is the spinal occulta, because it's not noticeable from the minute they're born. But there are signs and symptoms that you can, like nurses and doctors and even you can look out for. So if they've got things like birthmarks or other skin issues when they're born, and you find either tufts of hair or whatever on those or in those, ask for a spinal scan, just to rule out or rule in or whatever spina bifida, because it's a very common thing for the spinal occulta to sort of bring that out in a baby, a newborn. It's not normal for newborns to be born with tufts of hair and birthmarks and stuff, or to have skin things and tufts of hair all over them. It's not normal. So if you're a new mum and things like that are happening, I've got your newborn baby's got things like that on them, it's not normal. So ask for things like a spinal scan, because even if it will rule out spina bifida, it will show that it will put your mind at ease, and it will show that there's a possibility that there could be something off. They do all the blood works anyway. From the minute a child is born, they take bloods, they take everything. They do so many tests on your baby when the minute it's born anyway. So any other issues will come out of them. If there's any major issues, something will show up as being wrong in some of those. But if you find tufts of hair inside with things like birthmarks and spots and stuff, yeah, ask for a spinal scan. It's a good idea. As I say, when I was looking for things like how to treat it, so it's a lot of physiotherapy as they get older. You know, once they're actually walking, you know, yeah, and a lot of trips to paediatricians and doctors and scans and hospitals when they're little, just to watch out for it, contact it. I suppose it then depends on the type, but I couldn't find a lot about how to treat it when I was looking through it all, which is weird. A lot of it was just research and scientific-y stuff, and I can't put all of that out there, so yeah. I really hope I've done this condition some really good justice, because I know that somebody who's watching me has this condition, and I hope I've done it justice and I haven't missed anything super important. But yeah, I'm gonna go. I shall see you all later.